Are you getting migraine attacks when you exercise? This can be really frustrating and can make you want to stop or avoid exercise altogether. But here's the thing, there's actually 3 different scenarios for how exercise can be involved in triggering headache attacks. And each one tells us something a little bit different about what's going on for you in relationship to exercise. So I've worked with many patients and clients over the years navigating migraine and exercise. And I use this framework to help them stay active and while reducing the risk of attacks because of it. So stick around and you'll learn about these 3 different scenarios, what they mean, and how we can adapt your workouts without giving up on them to avoid migraine attacks. So hello, I'm Dr. Sam Kelikidis, and I'm a physical therapist specializing in the non-pharmacological care and management of migraine and other headache disorders. So this is something, again, I help many patients and coaching clients troubleshoot every single week. So when I sit down with a patient and they tell me that exercise triggers their migraine or headache attacks, I always want to know more. When did the attack start? Because timing changes the whole plan and how we manage this. So during exercise, what this tells us is, this usually means that the activity itself is probably a direct trigger. Now it could be a specific exercise, it could be due to neck strain, it could be to poor technique of the exercise, or too intense of an exercise. And we can modify the form, the pace of exercise, and the intensity to reduce your risk of headaches in this situation. Number 2 would be soon after exercise, so within an hour. This still likely exercise is playing a direct role, but it's often not about, it's more about like the session length, how you're ramping up with exercise, and how you're cooling down and recovering soon after with that specific exercise. Changing these factors can really make a big difference. And then the 3rd factor is hours later. This is where people kind of really get confused. If the attack is delayed, exercise probably isn't a standalone trigger in this instance. It's just adding to your migraine threshold. Think of it like a bucket. Exercise is adding water, but you only spill over when other factors like skipped meals, poor sleep, or high levels of stress combine with it. So if you have migraine, there's always a potential for exercise to trigger attacks. But sometimes it happens, and sometimes this is going to happen, and that is okay. What we don't want to see is that every time you exercise, it's occurring with every workout. That's a sign that we need to modify and adapt your exercise plan to stop and reduce attack risk. So if you're tired of migraine attacks keeping you from exercising, you can send me a message or drop the word plan in the comments, and we can get started on developing a routine that doesn't push you over your migraine thresholds, but actually helps you raise your migraine threshold so you have fewer migraine attacks.